This is Todd Bailey from Herbal Mana. Today, I've got a special guest. I've been looking forward to this for a couple of weeks. Dr. Ernest Kim. He's a chiropractor and so much more. Man, you've got quite a background. It's been awesome looking at both of your websites and other places online that you're mentioned. How did you get on this path? At what point did you say, hey, I want to do a lot of things and be awesome at more than one thing? Certainly awesome at bringing multiple disciplines to the practice. So, how did all this start?
Man, thanks for having me, by the way.
My
Really
pleasure.
happy to be here. I could start a number of ways, but I just feel like my whole life was setting me up for this path. I grew up lost, searching for answers, meaning of life. Who am I? What am I doing here? What's my purpose? And originally, I wasn't interested in this. I should start off by saying my father is an acupuncturist. And so I grew up in a holistic kind of lifestyle, but I always wanted to be different. I didn't want to follow his footsteps. And I felt like I wanted to carve my own path. So that was very clear to me early on. And because of that feeling, I purposely tried to look for something different. Business, pre-med, like I wanted to do something around people. I knew I loved being around people, helping people, but I wanted to do something completely different. But through my own injuries, through my own finding ways to rehab myself and my own interest in discovering myself led me to this path. So I could explain further, or we could just start there and go from there.
So, which discipline came first? Was it acupuncture first? Anything else
There's
first?
actually massage therapy. So
Massage therapy.
I started as a massage
Wow.
therapist because I was having a lot of back issues early on. And massage was the one thing that helped me so much. So I actually went to school for massage and started practicing massage, really enjoyed it. And through my practice, the first few years, I started getting really interested in energy healing. And so I wanted to energy healing mind, body, spirit. So massage is very physical. I wanted to find a way to incorporate the mind and the energy body. So that's how I was leading towards acupuncture because of that. I could do some muscle work, but I could also affect the energy body. And also in acupuncture, we look at the body holistically from not just physically, but your energy channels, your mind. Are you yin? Are you yang? Are you excess? Are you deficient? So we're looking at it from a much broader perspective. And I felt that I could help people more on that level. And so the school that I was looking at, they were offering at that time a dual degree program where you could study both chiropractic and acupuncture at the same time. So essentially, because
Awesome.
the science classes overlap, so you would just take the core science and then do the specific classes for both. It was really intense, 9 a.m. to 9 p.m. on most days. So I didn't have a life for 4 to 5 years, but I just felt like I might as well do this. I really want to do this because my background in massage, I just felt, okay, this makes sense. And that's how I ended up doing chiropractic and acupuncture as well.
Hmm. That's quite a load. It's bad enough doing the med school, but the double med school load. From there, straight into practice.
From there, yeah, after school, after I graduated, I went to work with my father at his office for about 5 years. And then from there, about 3 years into working with him, I decided to start my own practice. And so I was doing two things, kind of still working with him, starting my own practice in a smaller scale. And now I'm just full blown doing my own practice.
And at our company, we have topical creams and gels for pain. And it's interesting when I ask our customers if they're doing more than just rubbing the product on, which is awesome. We've got some awesome stuff, but we're always telling them you've got to do more massage, get adjustments, and do more. It's more than just rubbing something on, especially if you have a chronic problem, which is interesting. Occasionally, we have somebody buy the product, rub it on, call back in the next day. Hey, my chronic shoulder problem I've had for 20 years didn't go away overnight, magically. When somebody comes into you and they've got something chronic, how do you unpack the problems? How do you assess? If I walked into your clinic in LA, what would I expect to see? And what would you do? I would be a great candidate, by the way. I've had I think 20 orthopedic surgeries, more than my fair
Oh,
share.
good.
Yeah.
By the way, I did have a chance to look at your products, and I was very impressed by the quality and the ingredients. And
Oh, thanks.
I'm looking
We're a
forward to some of the
long
samples.
time getting those formulated, something natural that actually works.
I bet. And I actually have some questions for you later on about.
Okay, I'm ready for you.
Yeah,
I
I'm
walk
a
into your
big.
clinic. What's going to happen?
Yeah,
How do you
so
break it all down for somebody?
so typically when someone comes into my office and they have an appointment with me, I start with my exams. And while I'm doing my mostly physical exam, oftentimes, especially for first-time patients, I will intuitively sense that there's something more here than just a physical ailment. Even if it's an internal ailment, insomnia or stomach digestive disorders, whatnot, oftentimes I'm sensing something that is much deeper, whether that's emotional, whether that's past trauma, or a current relationship that's really stressing them out, some type of stress, tension, trauma, whatever it may be, that's not fully processed. Or sometimes it's even wanting to shift careers. They're just not fully happy in the current job position or whatever they're doing. And deep down inside, they want to try something else, but they're scared to, or whatever's holding them back. That blockage can manifest as pain, or it can manifest as some type of disorder or imbalance in the body. I'll share that with them if they're open to it. And that's how I start my treatment. When we try to find the cause of this, and from there, we will work on what we can do, whether that's physical, whether that's nutritional supplementation, whether that's acupuncture, altering the energy body, whatever it may be. The treatment protocol to me is only one half of the puzzle. Oftentimes, it's something internal that also needs balancing.
Oh, no, it's interesting. I paid a fancy consultant, this is a few years back, to help come up with topics, to help our dialogue with potential customers and with our big following. We've got a great email following, huge Facebook following. Some of the topics that I wanted to discuss were things like mindset, focus, gateway theory of pain, the soft side. And he chided me for wanting to waste time in those areas. That was somebody who really didn't understand pain. Because, like you said, so much of pain has to do with the emotions, the anxiety, whether that comes from the pain or contributes to the pain. It's cyclical
Yeah.
and can be vicious for those of us who have chronic conditions. Your approach is interesting, but I think it's spot on and it's refreshing because I don't see that at many practitioners. So instead, I end up with multiple practitioners because we don't have a single landing place where we can get mind, body, spirit all addressed.
Yeah, this might sound like a silly example, but I feel like most people can relate to this, which is depending on our state of mind, we perceive pain differently. For instance, if we are having a really bad day and someone were to come up to us, or it could be a friend or family member, and they, I don't know, shove us or playfully hit us or whatever, and depending on our mood, that could feel like a lot more painful than it might be, or that might set us off, or our reaction might be completely different. Versus if we just won the lottery and we're just elated and someone were to walk by and shove us to the ground, I think we would get back up and not be affected by that so much because we're so in a state of joy and elation, right? But the act of physical impact is the exact same, but we react differently, process it differently based on how our internal state of being is. I'm sure we can all understand this. How do you explain that scientifically? Hard to.
Certainly outside of Western medicine, allopathic medicine,
Yeah.
where they don't want to deal with that. They want to, for those folks, I've got folks I consult with, some of them are MDs, my buddies are MDs. I feel bad for them because I feel like they're stuck with the 4 Ps of practice under current Western medicine dominated by insurance. I tell them you've got 4 Ps of practice: poke, prod, prescribe, and push them out the door.
Mm.
And that's the model they're stuck with. And they're not very happy. A lot of my MD buddies have become less happy, less satisfied in their career as time has gone by. They're missing an opportunity to really connect and help. So it's good. I'm glad to hear that you take that approach. It's unique.
Yeah, I think they're also stuck with sort of the overall Western system, the insurance model, the pharmaceutical model, and there's so much behind the scenes that the public doesn't know of why it is the way it is. And even the medical doctors don't really understand because it starts from schooling. They're basically taught in school to prescribe, and a lot of this comes from the funding that's behind the scenes. So you're right. I don't blame medical doctors. I'm not against them, and I'm not against medicine or medication. But I think having an understanding of why we're in this model might help broaden the perspective, because there's a lot of medical doctors who practice functional medicine, who practice supplementation and less prescribing. So they're out there. I think the more this knowledge and information is spread, the more we're seeing medical doctors looking for different solutions.
Starting to see some of those practitioners popping up a little bit more.
Yeah.
They are certainly a very small minority.
Still, yeah.
Brave souls.
Yeah,
Okay, at your
definitely.
clinic, you've got a lot of things going on. So somebody comes to see you. You've mentioned chiropractic and acupuncture. What else goes on in the clinic?
We have massage therapy, stretch therapy, and then currently I am doing transformational coaching. I'm doing that. And we have some like Reiki, some energy healing type of modalities, cupping as well.
Mhm. How does that come into play?
Yeah, so basically it's life coaching with sort of a spiritual emphasis. It doesn't have to always include that, depending on the person. But I find that when someone comes to me and we find there's a deeper rooted cause, that always stems from a deeper nature, which I find related to our soul. What makes our soul sing more than just surviving, more than just working, more than just the daily grind? We
Mm.
all have a creative talent, we all have a creative ability. And I think tapping into that is what makes our soul sing. And so this transformational coaching is about reconnecting with that, discovering or enhancing it. If you've already discovered it, how can you embrace it and empower yourself more further by tapping into it deeper?
Is it in person? Is it sometimes at a distance? How do you approach that? What are the
Yeah,
options?
it's both, because typically in the chiropractic session, especially the first visit, some of that naturally comes up. Not that I'm necessarily coaching them, but we're discovering together what's coming up, right? And then from there, they can continue to come in person, or we can do it through Zoom, through phone calls. And for the coaching, you don't have to see me in person for it to happen. We can talk and discover it that way.
Interesting. How did you get into that? That is not normal chiropractic. It's not normal massage.
Yeah.
Why that fork in the road?
So going back to what I mentioned from the start, my life path that has led me this way, my questions for life. I grew up in a broken family, just saw a lot of family dysfunction. There was early experiences of emotional trauma, and that all led me to questioning, life and questioning my purpose. I started looking for ways to calm the anxiety, calm the stress, I used to get panic attacks because I was so lost. And one thing that really helped me was meditating and looking within, quieting the mind, which led me down a spiritual path, a spiritual journey. So, doing that work, the self healing and reading books and learning from teachers led me to integrating that into my practice, that mind, body, spirit. And as I began doing that, my intuition, my senses broadened, and in the treatments, it would just naturally surface. It would just come up, and I would talk to them and ask them, this might sound weird, but did this happen to you? Or are you thinking about this? And 9 times out of 10, they say yes.
Hmm.
And we go from there. So when I discovered that happening, I wanted more of a context. I wanted more of a organized way of exploring that. So I went and got certified in spiritual life coaching.
Wow, that's awesome.
It was definitely a risk. It was definitely something that I was hesitant to do because I didn't want to lose patients or people from scaring them off. This is too woo-woo. This is too out there for them, offending anybody. So For a while, I hesitated going down that path, but when it keeps coming up over and over again, I just couldn't ignore it anymore.
I hang out with the chronic pain crowd. There are a lot of folks who are stuck in that pain cycle
Yeah,
because they're stuck in fear. They're stuck in an emotional loop, which
yeah,
keeps feeding that pain
yeah,
and even a sense of hopelessness. And they can't quite break out because they won't deal with some of the emotional side. It is a little too touchy-feely, a little too, as some of them say,
yeah.
and that keeps them stuck. Do the other modalities help when somebody's emotionally stuck? For instance, does acupuncture help somebody that's going to help them break out somehow, or at least give them some leverage to break out?
Definitely. It's
How does
tricky
how,
one.
how does acupuncture help?
Yeah, sure. First of all, my experience with chronic pain, fibromyalgia, those type of patients, most of them have had some type of emotional or physical trauma in the past. Almost all of them. And I find that very interesting because I find that to be correlated. I don't know if it's cause, right? There's no
Hmm.
way to actually prove that yet, but I definitely think there's a correlation there. And like you mentioned earlier about the brain that gets programmed when you're constantly perceiving pain, constantly experiencing it, constantly telling yourself you're in pain. After some time, that almost becomes plastic, like your brain internalizes it and it becomes,
Right.
it just fires those signals almost automatically. And I think we're still early, we're in the early stages of understanding how that works. And oftentimes these patients go to their primary care and they're just told it's just stress. Just take, an antidepressant because you do an MRI, you do an X-ray, you do all these tests, and there's no indicator of why you're having pain. So a lot of these people either get put on pain medication or just told that it's just in their head. And that can be very frustrating. That can really keep somebody in the pain cycle as well when someone's telling you you're crazy. You're making this up, right? But going back to your question about acupuncture, the way that can help is so acupuncture, think of our body as having electric pathways and it's like an electric circuitry board in our body, right? And electricity flows, and that's what gives us life. That's what animates us. And when we're depressed or when we have pain, this flow of electricity gets impeded. It's not flowing the way it needs to be flowing. It's flowing slower or it's getting stuck in certain parts of the body. And so what acupuncture does is when you stimulate certain points in the body, it signals the brain to allow that flow to get restored. So when someone comes in with chronic pain, acupuncture can help restore that flow so that they're not sensing or perceiving the pain in the same way as before. Now, for some people, this works amazing. This works great. Sometimes it even takes care of the pain completely, and some people have full resolution. Some people have partial. Some people need it for maintenance. And for some people, just like any modality, it doesn't work as well. They need to find something that works well for them. Everybody is different. But in general, I would say it can at least help bring it down a notch.
That's what I found. It brings it down a notch or two. Very helpful. I've seen a little different sort of version. Some practitioners are doing dry needling.
Yeah.
It is not the same thing. What's the difference for anybody watching this? I've had
Yeah.
both. I use them for different things.
I practice both as well. And so I just explained what acupuncture does. It's affecting the energy system in your body. Dry needling is more of finding adhesions in the body and using the needles to break up the adhesions physically. Typically, one clear sign that you'll notice visually between the two is dry needling. Typically, there's repetitive motion in the area. You're stimulating that point and also breaking up the scar tissue that you find in that point rapidly. Dry needling is practiced by physical therapists, chiropractors, acupuncturists. Those are the three, I think, in the US that I'm familiar with. They do not receive the full education of acupuncturists, so they are usually not educated in the energy system, the meridians, the points, the whole theory of acupuncture, which goes so deep. So they're primarily just locating points in the body physically that you can sense is knotted or is painful. and then they needle that point to hopefully relax the muscles. It's really good for spasms. It can help calm the spasms down. Typically, there's more needles used in dry needling. So those are the major differences.
I have benefited from both, no question.
Yeah. Yeah.
The dry needling, very localized, and not the same emotional release that I get with acupuncture, where I just down regulate my entire system. But it is nice when I've got something stuck. A muscle that just won't let go. That dry needling is pretty awesome.
That's awesome that you can separate the two and understand the difference. Most
That
people.
helps that I've been at this for a lot of years, having
Sure.
a lot of injuries, a lot of surgeries, a few broken bones along the way. I get to
Oh
try
man.
everything. So I find your clinic really fascinating because I have to go to a different massage. Actually, I use a couple of massage therapists, a couple of
Yeah,
different chiropractors, a
right.
naturopath. I can't get everything in one place. And even when I'm working with massage therapists, I actually use three for different things.
Yeah,
I've got my
same.
favorite, and then I've got two that are just different enough, but none of them quite get the emotional side, which is okay. They can still do the body work. The chiropractor, same kind of thing. Good folks, different specialties.
Yeah,
None of them address the emotional side.
yeah,
So it leaves a bit of a gap. As far as nutrition,
yeah.
if I come in, chronic injuries, chronic inflammation, what are three things that you would tell me to stop doing that you
In
typically
terms,
see in your patients? Three things that are just common mistakes that we as patients are making.
you mean in terms of lifestyle or in terms of
Lifestyle,
nutrition?
diet, just some of the common problems that pop up when you're counseling with patients.
Common problems that pop up is inflammation. A lot of us, we are ingesting foods or drinks that are causing inflammation in the body. I would say that's number one, first and foremost. Number two is stress. Off the top of my head, those are the top two things I talk about the most. Number three can be a bunch of different things. It can be rest, it could be exercise, it could be, yeah, it could be a number of things. But I would say the top two that I find that contributes to pain and dysfunction in the body is inflammatory, whether that's through nutrition, physical, environmental, and stress.
What are some of the foods you would typically tell folks to stop eating in the typical American diet?
Yeah. The list is long, but it's also very, everybody is different. If being a vegan works for you, it may not work for somebody else. But I don't like to talk about a specific diet, but some of the things I think that's common across the board, especially in the American diet, that we can do a lot less of is sugar, alcohol, anything that sugar, alcohol. I think we can all generally do a little less carbs. I'm not saying everyone needs to go full keto, but generally, I feel like we could do a little less carbs, a little less on the portions. But yeah, I would say I talk a lot about decreasing sugar. People think sugar is just candy, but it's not. Alcohol is broken down into sugars. Simple carbs are broken down into sugars. So even if you don't have a sweet tooth, if you're eating a lot of pasta breads, alcohol, that's breaks down to sugar. But I'm just a little hesitant to go too much into detail here because everyone's so different. Like my body type, I actually function well with carbs. So I try to keep my carbs more complex, but I don't do well with keto. Whereas somebody else, they do a lot better with keto. So I'm a big fan of functional medicine. I'm a big fan of genetic testing and doing a full lab panel to discover what would work best for you, and then doing food sensitivities.
I was hoping that's where this would go. That's what I've done with my naturopath because I felt like with all of my reading, all of my studying, I was still in the dark. I could feel pretty good on any diet for a time, but not for very long. But then I finally got with her and she put me through a whole bunch of tests, a whole bunch of even the genetics testing. And now I get a new battery of testing every 3 or 4 months because I've got a
Yeah.
few things going on. And we're able to identify things that work, things that don't work, enzymes that I make well, some enzymes I don't make at all. And it really filled in the gaps. And now I know what to eat, what not to eat much more clearly. And it's made it a lot easier. I found that there's some things I can still enjoy. A lot of meat,
Yeah,
a lot of fruit.
yeah,
But it turns out my body just loves fruit, loves meat. And I'm happy with it.
same, same. And there's also some studies showing that the sugar you get from fruit is different from sugar you get from, preservatives and candies and things like that too. So yeah, again,
No doubt about that. Hey, on the practice side, you've got a pretty big crew. How do you manage so many professionals and such a large staff?
yeah, that's an area that I'm still learning and still understanding. My goal is not to have the biggest crew possible. It just has grown that way as we've grown. We also have 6 treatment rooms going on at one time. So we've got usually about 2 chiropractors and 1 acupuncturist and 3 or 4 massage therapists going on at once. And naturally, everyone's schedule is different. So you just end up having a bigger team. In a perfect world, I'd prefer a smaller team where everyone's has a they're available more days and it's a smaller team because it's just easier to manage, but it's also easier for the patients to manage as well and remember who's who and who their go-to people are. But I think just like in any social environment or hospital settings, there's a constant sort of revolving door of personnel that changes. But my goal is to maximize, or I should say, lengthen the time between the changes so that we can try to keep a similar core of practitioners. And also because we work together as a team, we have so many patients who will get acupuncture and then go get a massage right across the way in the hallway on the same day. And so our providers, we work together, we collaborate, but also the patients love seeing the collaboration and they get better through that. So they usually have their favorite practitioners. So it's not easy when practitioners leave and when they change and things like that. That's still a question that I'm trying to answer myself.
I think with business these days, there's always some motion, maybe even some commotion, people
Yeah.
coming and going, life happening. It's just impressive when you've got a staff that large that functions. I know how I know how challenging that can be.
One thing that I require with everyone on our team is that we share the same vision, which is being heart-centered, patient-centered focus. Everyone comes in and everyone really gets excited about seeing the improvements, seeing the healing take place. And so I can vouch for every practitioner in our clinic that we all share that same vision. And when that happens, it seems like a lot of good things come from that.
Good to have the multiple disciplines all on the same page. That would be
Yeah.
great from a patient's point of view.
It's also good for the practitioners too, because we see the benefit of how different modalities can help people. And so it helps us look good too, because we're helping patients and they're getting better faster when they're doing other things too.
One of the things my MD buddies are missing, and it's part of the equation that kind of hurts the model, the MD model. They're not getting the close contact. They're not seeing the changes that are occurring in the patients. They get a limited amount of time, prescription, and the patient's out the door. And some of my buddies miss the days where they could spend more time, have more relationships, see more change. And it's not as satisfying. I would rather be there for some of the change, whether it's through me or through the team, through the staff, just to see that we're really affecting lives.
Even within our industry, there's a lot of practitioners. One example is there's a lot of chiropractors who have a very high volume practice, so they don't have a lot of time to spend with
Right.
each patient. And so there's like patients are in and out. And so some of our practitioners who've been in that setting, they get burned out or they're not satisfied because they don't get to see, they don't get to feel the satisfaction from helping somebody because it's so quick. And in our environment, it's different. So they sense that and they find joy in that. And I get that type of feedback from some of the providers.
In it for the relationship, not just the transaction.
Yeah. And I think that model is slowly changing in all areas of healthcare. We still have a lot more work to do, but I think the demand is starting to increase. As technology increases, we're seeing a lot more surgeons doing PRP, regenerative medicine, rather than just going straight to surgery or straight to prescribing pain medication. So I think we're starting to see more of a patient-centered approach happening little by little.
I hope it happens a little faster. It's
Yeah,
a
me
slow
too.
change and it's very individual. I, as my main surgeon, he is open like that, but most of his colleagues are very set in the routines. We've had this
Yeah.
discussion. It's sad that I've got my main surgeon, I've got my guy, my body guy. Once in a great while, he has to jump in and help if the rest of the team can't keep me going.
Yeah, because it's you make more money doing the surgery versus giving somebody a PRP injection, you
That
know.
is true. Can you give PRP injections in California?
Not as a chiropractor myself, but that is something I'm looking to incorporate by having someone on our staff that can do that. Regenerative medicine is definitely something that I want to get into and offer as
I
another
think it's
service.
fantastic.
Yeah, I've had it done.
I had a piano moving incident a year and a half ago. Should not have been moving a piano. Made quite a
Yeah.
mess. Tore quite a few things. Ended up with a series of PRP injections, peptide injections, and even rented an H-spot, a hyperbaric chamber. Just had that here in the home. Did 60 treatments with that before the naturopath and the other natural folks got me on that protocol. I had already seen my surgeon and had an MRI, and they said surgery's coming. Torn cuff, nearly complete tear in the labrum, torn biceps tendon. And they said, all right, we'll get you scheduled. But the naturopath, she said, no, let's give this a couple months. And we went through this other protocol, and actually everything healed back up pretty nicely,
Wow.
which beats the heck out of another shoulder surgery.
Did you do any stem cells?
Pardon me,
Just PRP and hyperbaric?
PRP, hyperrectal
Ah,
chamber. I can't remember which two peptides. Had two peptides that I was injecting every day. Yeah, I was going through, yeah, quite a few injections. But
BPC 157?
yes, that was one. I can't remember what the other one was. One in the morning, one at night, two different sites each time. I was shooting up shoulders and knees since I had issues
Awesome.
going on everywhere.
Yeah,
But it was fabulous. I would take that over a shoulder surgery. Shoulder surgeries are, well,
any
they're just
day.
miserable, especially
Yeah,
one that involved. That would have been a bugger to recover from.
I
So
bet. Yeah.
fortunately, I got to the natural team before the surgeon got a hold of me. And he was very pleased, actually. When I told him everything I was doing, he said, that's everything I would prescribe. I can't think of anything else to add to what they're doing. Come back and see me in a couple of months. We'll see how it's progressing. And he was very pleased.
That's awesome.
But he's
It's
also
awesome to
very
have.
open minded. He's a different sort of
Yeah.
MD,
Yeah.
really good
That's
guy.
great.
Yeah. You said you had some questions about what we put into our products. What kind of
Yeah.
questions?
So I noticed on one of the products you have DMSO, and that's something that I've been looking into more and more. What is, I'm sure you've had personal experience with this with your own body. How's that helped you? Or am I assuming?
Oh, it helps. It's tremendous. The DMSO is dimethyl sulfoxide. My first exposure was probably not the right way to get it, was at the local feed store. I grew up on a ranch, and you could get DMSO in the horse section. I wasn't using it, but I was able to learn from the horse guys why it was used. If a
Hmm.
racehorse would get injured, they would use that on the joint and get some really rapid relief for inflammation and even some of the tissue damage. And I had some buddies, high school athlete buddies, who would get injuries and use that. Not the right place to get it. It's not fit for humans, but it was good enough for teenage boys. And they got amazing results. Fast forward a couple of decades and about a dozen or so surgeries, I ran into it again, but I was able to get it in a purified form, pharmaceutical grade. And that's when we started experimenting somewhat with it, got deep into the research. And it's phenomenal. On its own, it's a powerful anti inflammatory, and it's a free radical scavenger. It will bind with free radicals so that we can avoid some of the damage, the inflammation that will come from having the free radicals And it will also increase cell wall permeability. And it does it in some pretty interesting ways. It is able to bond with both waters and fats. And it moves really well through the skin and down into the lower tissue and the bloodstream. And it can take things right along with it. So if we're using an essential oil that helps with inflammation, we'll get the benefit of the DMSO and the essential oil. Plus, in the chronic pain crowd, we chronic pain folks run chronically low on magnesium, among other things. And we can take the magnesium right into the tissue. And the response is phenomenal for pain and for inflammation. And the recovery process is enhanced and just much quicker. So we incorporate DMSO in just about everything we do. It's a little tricky. The manufacturing side is a little tricky because it's an interesting compound, but the outcomes are awesome.
Did you also take it orally?
I have, and it works well, but you smell like garlic.
Oh, really?
Oh,
Why is
yeah.
that?
Yeah. DMSO itself draws water, it draws moisture. In fact, if you leave a container of DMSO open, it will draw water right out of the air and bind with it. It doesn't hurt the effectiveness of the DMSO, but in that binding process, it releases a smell like garlic. If you
Oh.
ingest a lot of DMSO, it's good for your system, and you will smell like garlic. Kind of easy on it. Yep, yep. Or you start chasing your friends away.
Interesting.
Yeah, it's an interesting substance. It's natural, it comes from trees. It's part of the process of wood pulping. It's just a byproduct.
Yeah.
The only problem with DMSO is that it's a natural product. Pharmaceutical companies can't control a natural product.
Right.
Pharmaceutical companies aren't too excited about it. It's funny because the pharmaceutical companies pretty much control the FDA as far as what's allowed, what's permitted. And publicly, they'll often say DMSO doesn't do anything, it's worthless, don't use it. And yet, on a practical basis, the FDA has approved it for even some internal uses. And the FDA, through its various processes, uses it every single day. For instance, if you need to have an organ harvested from one person and transported to somebody else, it's packed in DMSO. DMSO lowers the freezing point and preserves the tissue. If the tissue freezes, you get crystallization that will damage the tissue. The DMSO keeps that from occurring and protects the tissue. So it's used every single day. And if you go to PubMed for medical information and studies, you'll find DMSO used in experiments, applications, drug delivery throughout PubMed. You can find thousands of studies that refer to it and quite a few that actually study DMSO. So it's pretty interesting. It's just frowned on a little bit by the pharmaceutical companies because they cannot own it. But the same is true of other things that I think are pretty awesome, like frankincense. Frankincense in its right form is a pretty handy substance. But if you ask a pharmaceutical company, does it have any value? If you go to WebMD, that's very skeptical. It smells good. But as far as any real value for the body, we're not really sure. But then you go to peer review studies like you'd see in PubMed. Oh, frankincense is phenomenal. It's got lots of uses, proven uses. It's just that bias
Yeah.
pharmaceuticals have against something they can't own, control, and profit from.
And that's the model that we're functioning in, and that's the model that medical doctors are taught and functioning in. They
Exactly.
don't, unless they question, think outside the box, they're just programmed and trained to automatically say, nope, DMSO doesn't work. And so when their patients come in, ask about it, most of them will say, nope, that's not science. Don't go there.
Yep. Yep. Got to
Yeah.
follow the orthodoxy. We saw that with the whole COVID epidemic. Actually saw doctors that are outstanding in their fields, just outstanding physicians that didn't follow the orthodoxy, and they were criticized. Some were drawn up essentially on charges, complaints to the medical board. And some
Yeah.
of these are giants in their field. There's a fellow up in, I think, Boise, Idaho. His last name is Cole. He's an epidemiologist. He's just amazing. He publicly said, this is a virus. Let's treat it like a virus. He had a virus protocol, much like the Cleveland Clinic. He had his license threatened by the state board for not following the COVID protocols and saying something crazy like this virus is a virus. Let's treat it like a virus, among other things.
Right.
Calling for no masking, no isolating if you're infected. He just said, bring a virus protocol to bear on it. It's interesting.
Yeah.
Yeah.
And a lot of that's
You're
coming
in
to
your
light.
space.
I know, but I was following that pretty closely just for my own sanity, just for my own research purposes. And I'm glad most of it is over with.
Oh, it's
Most
kind of
of it.
funny when I visit California, it's not entirely over. There's still a percentage that are clinging to it.
Yeah. Where are you located?
Boise, Idaho,
Oh, okay.
most days.
Cool.
And
Okay.
you are in Torrance?
Yep, Torrance, we're about 30 minutes south of West LA near the beach. I don't know if you've heard of Manhattan Beach, Hermosa
Oh,
Beach,
yes.
Redondo Beach. It's called the South Bay. So that's where I'm at.
Yeah, I know the area
Oh, okay. 20
was
minutes for me.
6 weeks ago. Bit Long Beach, Newport, Laguna.
Oh, nice.
Any plans to open another clinic?
Yeah, I'm thinking of expanding the office currently and including the regenerative, the PRP, the stem cells, the peptides. I'm really fascinated with peptides lately, hearing so many good things about it. Aesthetics as well, laser. There's so much technology coming out, especially in Asia, with ways to improve your skin and improve the anti-aging, basically. So I'm really interested in those and functional medicine. So that's what I'd like to incorporate into the practice, hopefully by next year.
Fantastic.
Yeah, and then we'll see from there. Doing a franchise is hard when the quality of care is hard to replicate. If we were just like another high volume type of practice where the quality of care isn't necessary, it'd be much easier to just franchise that, just SOPs, apply that training. But because we are specific with the practitioners that we handpick, I'm trying to figure out if how can I replicate that. So until we can figure that out, I'm just going to keep expanding and adding services so that we can help more people.
Fortunately, you're in an area with plenty of potential patients.
Definitely. And patients that want it. The demand is definitely here. And
That's a great place to be.
yeah.
All right. This has been awesome. Your background is fascinating. I love everything you do in the practice and appreciate you taking the time to do this interview.
Thanks again for having me. I'd love to speak with you again because I can just tell you also have a lot of knowledge and experience. I think being a patient first is so helpful when you're helping other people because you have direct experience of what it's like to suffer, what it's like to be in pain and try to find solutions for that. So I can tell that's what you're doing. Your passion and wanting to help others is obvious just from talking with you today. That was very refreshing. I could learn a lot from you too. Hopefully we can stay in touch and whether we're doing another podcast or off the record, I'd love to talk with you more.
I appreciate that. Thank you, Dr. Kim.
Thanks.
All
Have a
right.
good rest of your day.
You too. Bye-bye.